would be more challenging?
So this is the sticky point of recent science because we see all these research studies and meta-analyses that are coming out of the sports science literature saying that there is no effect of the menstrual cycle on anything. When you look at that population, it is specifically eumenorrheic women might have a subject pool of 10 if you're lucky, 12.
So this is women who have quote unquote normal menstrual cycles, eumenorrheic.
Supposedly ovulating. So they have a definitive low hormone and high hormone phase.
And this is probably because these studies are being done on university campuses with college undergraduate women.
Yes, exactly.
Okay.
Yeah.
Which is typically is in a given age range.
Right.
Okay.
And they look at performance, meaning that one point in time. And we know that psychologically you can perform at any point in the menstrual cycle unless you have something like heavy menstrual bleeding. When we're looking at a higher touch and looking not only from a molecular aspect, but also pulling in mixed methods and looking at the qualitative, we need women to track their own cycle and find their own patterns because we know that there are times where you feel like crap and you can't push intensity, but that might be on day 8 for one woman, it might be day 18 for another. From a molecular standpoint, we know that the low hormone phase, being day 1 is the first day of bleeding, up through ovulation, which is midway through your cycle, you have a greater capacity for pulling in and accommodating stress, physical and mental stress. So if we're looking at doing heavier loads, we're looking at doing high intensity work, we're looking at motivation, then that low hormone phase is really optimal for trying to hit a PR or trying to hit a new speed because you can take on that stress and your immune system handles it, your muscles handle it, your core temperature, everything handles it.
So for most women in the weeks before their period, they're going to feel more robust, except right up until the point of menstruation, or the inverse?
It is day 1 of bleeding up through mid-cycle that I can feel great.
Yep.
The sticky point comes, not every woman ovulates. And this is a thing when we're looking at general pop. We have lifestyle stress. We have nutrition stress. We know that women, for the most part, have 4 to 5 anovulatory cycles a year. So this is where, when you're looking at that high hormone phase, we can't say you're definitively in the high hormone phase. So this is where we need women to track their own cycles and understand their own patterns. Because in an ideal world, we know that in the luteal phase, this is where we have the most change, where we have a pro-inflammatory response from the immune system. We have inability to access carbohydrate as well. We have a higher sympathetic drive. So there's lots of things in there that aren't so fantastic for accommodating stress.
So broadly speaking, the luteal phase is associated with more cortisol, more kind of baseline levels of stress. Would it make sense for a woman to try and offset some of that with a bit more nutrition during that phase, a bit more perhaps complex carbohydrate? We know that some complex carbohydrate can blunt some of the cortisol response.
Exactly.
Maybe just even a little bit more attention to eating.
Yeah, absolutely. I mean, core temperature goes up, but the whole goal of the luteal phase is to build tissue. So this is where we're seeing a lot of shuttling of carbohydrate and amino acids to go to build that endometrial lining. And that's the whole goal. So yes, you need to eat more protein, you need to eat more carbohydrate. But again, the sticking point is, did you ovulate or not? So if you aren't aware of if you ovulated or not, you're tracking your own patterns, then just be acutely aware that in about the week before your next period comes, you really need to be amping up carbohydrate and protein. Because that's going to help you hit intensities. It's going to kind of level that playing field, especially on days where you feel like you can really hit those intensities, you feel great, but then you go to do something and your heart rate's higher than it should be. You don't feel that you can hit those. If you're offsetting it with some increased carbohydrate beforehand, you're going to hit it. So it's really dialing it back down to the individual now because we don't have enough robust research to make generalized ideas because of the nuance of have you ovulated or not? What are your ratios of estrogen, progesterone in that luteal phase? So when we bring it back down to the general pop, it's like the best thing to do is to track your menstrual cycle over sleep, over how you're feeling, find your own patterns, and dial in your training and your days according to what your pattern is.